Hello and welcome. Today we're diving into a common yet often misunderstood topic, ovarian cysts. These fluid-filled sacs can develop on or inside the ovaries, and while many are harmless, it's crucial to understand what they are, why they occur, and how they can be managed. Join us as we explore the world of ovarian cysts. The exact cause of ovarian cysts isn't always clear, but hormonal imbalances play a significant role. Many cysts develop as a normal part of the menstrual cycle. For example, functional cysts, the most common type, form when a follicle, which normally releases an egg, either doesn't release the egg, a follicular cyst, or after releasing the egg, the follicle seals off and fills with fluid, a corpus luteum cyst. Other causes or contributing factors include hormonal problems, medications like fertility drugs, endometriosis, and less commonly, genetic factors. Let's break down the development of ovarian cysts. As we mentioned, functional cysts are often linked to the menstrual cycle. Follicular cysts arise when the follicles rupture and release an egg, continuing to grow. Corpus luteum cysts occur when the corpus luteum, which forms after egg release, fills with fluid or blood. Other types of cysts, like dermoid cysts or cystadenomas, develop from different ovarian tissues and have distinct growth patterns. The size, composition, and location of the cyst influence whether it causes symptoms or poses any risk. Ovarian cysts are incredibly common, particularly in women of reproductive age. Most women will develop at least one cyst during their lifetime. Functional cysts are the most prevalent and often resolve on their own. The occurrence of other types of cysts, such as dermoid cysts or cystadenomas, varies but is generally less frequent. Specific data may vary depending on the population studied, but the overall prevalence highlights the importance of understanding and monitoring ovarian cysts. Many ovarian cysts cause no symptoms at all and are often discovered during routine pelvic exams. However, when symptoms do occur, they can include pelvic pain, which may be dull, sharp, or intermittent. Other possible symptoms are abdominal bloating, a feeling of fullness or pressure in the abdomen, pain during bowel movements, nausea, vomiting, breast tenderness, weight gain, frequent urination, and painful intercourse. In rare cases, a cyst can rupture or cause ovarian torsion, leading to severe pain and requiring immediate medical attention. Diagnosing ovarian cysts typically involves a pelvic exam. If a cyst is suspected, imaging tests are usually ordered. Ultrasound is a common first step, providing a clear image of the ovaries and allowing doctors to assess the size, shape, and location of the cyst. In some cases, further imaging, like a CT scan or MRI, may be needed, particularly if the cyst is large or has unusual characteristics. Blood tests, including hormone level assessments and cancer marker tests, might be performed to rule out other conditions or assess the risk of malignancy. While we've touched on some types already, let's categorize ovarian cysts more specifically. Functional cysts, including follicular and corpus luteum cysts, are the most common. Dermoid cysts, also called teratomas, contain different types of tissue, such as skin, hair, and teeth. Cystadenomas are cysts that develop from the outer surface of the ovary and can be filled with watery or mucus fluid. Endometriomas, or chocolate cysts, are associated with endometriosis, where uterine tissue grows outside the uterus and can form cysts on the ovaries. Understanding the type of cyst is vital for determining the appropriate course of treatment. Treatment for ovarian cysts depends on several factors, including the patient's age, cyst size and appearance, and symptoms. Many functional cysts resolve on their own within a few menstrual cycles, requiring only watchful waiting. Pain relievers, like over-the-counter or prescription medications, can manage discomfort. Hormonal birth control, such as birth control pills, can prevent the formation of new cysts. If the cyst is large, growing, causing severe symptoms, or suspected of being cancerous, surgery may be necessary. Surgical options include laparoscopy, a minimally invasive procedure, or laparotomy, a more extensive surgery. The choice of surgical method depends on the specific characteristics of the cyst. Unfortunately, there is no guaranteed way to prevent all ovarian cysts. However, hormonal birth control can reduce the risk of developing functional cysts. Maintaining a healthy lifestyle, including a balanced diet and regular exercise, is always beneficial for overall health. Women with a history of ovarian cysts should have regular pelvic exams to monitor for any changes. The prognosis for most ovarian cysts is excellent. Functional cysts typically disappear on their own without treatment. Even when surgery is necessary, the outcomes are generally very good. Recent research is focusing on identifying biomarkers to differentiate between benign and malignant cysts, leading to more targeted treatment approaches. Additionally, advancements in minimally invasive surgical techniques are improving recovery times and minimizing complications. Ongoing research continues to improve our understanding and management of ovarian cysts.